The Affordable Care Act, Implications for Healthcare, Access, and Quality. Presented by Kimberly Allen, Naima Grove, Bertos Kassir, and Stephanie Schaefer. What is the Affordable Care Act? The Affordable Care Act, also known as the ACA, is a health reform law that was signed in March of 2010. It is geared to reorganize health care and health insurance in America. The purpose of the ACA aims to increase the quality, access, and cost of both private and public health insurances to the uninsured individuals in the U.S. The ACA also aims to limit the increasing debt that the U.S. healthcare system is spending at an unmaintainable rate. Who is newly covered and how is this achieved? Since the ACA has been in effect, a net total of 11 million people have become newly covered. Those newly covered are insured through state and federal marketplaces and exchanges. It is estimated that 4 million are completely newly covered, while 7 million have transitioned to marketplace plans from another source of insurance coverage. Through individual state exchanges and marketplaces, those previously uninsured and those who did not have adequate coverage have had increased access to coverage. 30 states plus DC have expanded Medicaid coverage through the ACA. The ACA has allowed young adults to remain on their parents' health care plan until age 26 and no longer allows health plans to deny benefits to children under the age of 19 due to pre-existing conditions. Employer-based health insurance still remains number one of those newly enrolled, followed by Medicaid, individual marketplaces, non-marketplace health insurance plans, and other sources. Of the 12.6 million Americans newly enrolled in Medicaid, 6.1 were previously uninsured. What are exchanges and how are different states approaching them? Health insurance exchanges are also known as health insurance marketplaces. Exchanges are federal websites used to apply for, enroll, and purchase health insurance. Exchanges typically open enrollment on November the 15th and end on February 15th. There are three types of exchanges: state-run, federal-run, and partnership-run. Maryland has a state-run exchange. Many states have set up their own exchange or marketplace websites. However, some have not and use the general federal health insurance marketplace. So far, there are only 17 states who have set up their own exchange. Exchanges create a pool on consumers that brings together buying power of individual buyers and small businesses to obtain health insurance at a reduced cost. This, paired with marketplace competition, brings down prices for everyone. However, some regions of some states still lack this competition. The ACA also increased federal funds for Medicaid and addresses several components of the Medicaid program by establishing a minimum Medicaid income eligibility level, providing fully funded coverage until 2020 when it will decrease to 90% coverage, making improvements to quality of care and investments in prevention and wellness, and by making investments to ensure that states have the necessary information technology applications to adequately support the wide expansion of Medicaid benefits to those who were previously uninsured. The ACA's effect on health insurance premiums. Historically, health insurance premium rates steadily increased due to increases in healthcare costs. This is especially true for the last 40 years. In fact, premium rates are rising faster than income, which is one reason why individuals in the United States are unable to access affordable health insurance. The principal reason health insurance rates increased under the ACA is because insurers are now required to extend coverage to high-risk consumers. Before the ACA was implemented, insurance companies had the option to deny individuals with pre-existing conditions or to selectively charge higher rates to individuals based on their gender or their health condition. Increases were highest between 2010 and 2014. However, as of 2015, much of the increases in insurance premiums has slowed significantly. Also, many individuals can receive reduced premiums by signing up for a plan on their state's insurance marketplace. The ACA political debate. As of 2012, the majority of states had launched or joined lawsuits asserting that the ACA violates the federal Constitution. This movement included officials from both the Democratic and Republican parties. The opponents presume that the ACA is unconstitutional for several reasons. First is the individual mandate, where the ACA requires all individuals to purchase health insurance regardless of being involved in interstate commerce, which exceeds the power of Congress. Second, taxes triggered by some form of a transaction such as receiving income or buying a taxed product. Purchasing insurance is not a tax transaction by definition. Opponents argue that the federal government does not have the right to impose a penalty and assume a tax on individuals who aren't involved in transactions. Third, while Medicaid offers federal subsidies to induce states to administer programs to cover medical costs for low-income residents, the ACA threatened to withdraw federal assistance as a penalty for not expanding Medicaid coverage. Opponents argue that this type of coercion would be a breach of the 10th Amendment. Proponents, on the other hand, say that if Congress has the power to force young people into military service based on age and health status, then why can't it impose the obligation of buying health insurance? In addition, they also feel that the insurance mandate can be viewed as a tax rather than penalty, and the federal government has the right to impose tax on individuals who fail to purchase insurance. The ACA political debate concerning Medicaid expansion. The Supreme Court's ruling in June 2012 gave states the right to opt out of Medicaid expansion. States that did not opt out, such as Florida and Colorado, considered Medicaid expansion to be costly, even though the federal government is paying for almost 100% during implementation. It costs states like Florida about $5 each year per person to cover all uninsured below the 138% federal poverty level. This results in approximately 3 million uninsured adults falling into a coverage gap whom would have qualified for Medicaid if their state opted to expand. On the other hand, states such as Michigan have already proved that the ACA is working. It has reduced both overall spending and the number of uninsured residents. ACA implementation challenges. First and most important challenge is states opting out of Medicaid expansion due to skepticism or budget problems. Second is the high number of uninsured adults that are opting to pay the penalty fee as opposed to buying insurance. Third challenge is the difficulty people are experiencing in keeping their existing plans if it didn't qualify for grandfather status. Additional challenges are high-priced premiums and deductibles, inability to maintain current physician, and physician shortages. Overall, is the Affordable Care Act a good or a bad law? Well, that depends on who you ask. The public has remained deeply divided on this health reform law since it was passed in March 2010. The ACA has affected different groups of people in different ways. If you ask the nearly 17 million Americans who now have health insurance under the law, they would say it's a good law, along with the 12.3 million additional individuals who are now enrolled in Medicaid and CHIP as a result of the Medicaid expansion. Providing insurance for millions and making preventative care free helps to lower overall healthcare costs because people receive treatment before they need expensive emergency room services. Quality care is also on an upward trajectory with 17% decline in hospital-acquired conditions and fewer avoidable hospital readmissions. Reimbursement is moving toward being based on value and quality rather than volume and quantity. The formation of accountable care organizations has generated a combined $417 million in savings for Medicare. Despite the many positive changes that have come from the enactment of the Affordable Care Act, a near majority of Americans still oppose it. Polls consistently show that it is supported by less than 50% of Americans. A good amount of opposition, however, is based on political affiliation. The overwhelmingly negative TV ads against the ACA by the Republican candidates in the elections of 2012 and 2014 have had a major impact on Americans' views of the ACA. More than 60% of Americans have stated that most of what they know about the ACA came from watching TV. Many oppose the individual mandate and the government's role in health care. However, mandated health is not new to the U.S. Medicare is mandated health insurance for seniors that has been administered by the government since 1965. Ironically, it is overwhelmingly approved by the public. There are different groups of people who don't think that the Affordable Care Act is a good law. Providers' opinions of the law seem to have worsened. In a survey of nurse practitioners and physician assistants, they reported that they are spending more time on non-clinical administrative tasks, earning less revenue per patient, and believe that the ACA is contributing to healthcare costs. An article by Dr. Fodeman, a visiting fellow at the Galen Institute, explains that the increased bureaucratic red tape, additional paperwork, more oversight, and less autonomy will likely drain job satisfaction and push doctors to retire or switch careers. Nearly half of primary care providers surveyed by the Kaiser Family Foundation and the Commonwealth Fund said that because of the ACA, they would not advise a young person to pursue a career in primary care. There is no such thing as a perfect healthcare system. Although there are some issues with the implementation of the Affordable Care Act, overall, the concept is good and it has made significant changes in our healthcare industry for the better. The law protects consumers by eliminating coverage denials for people with pre-existing conditions, creates health exchanges where consumers can buy high-quality, affordable private plans, and expands Medicaid to more low-income Americans. These changes bring us closer to the goal of high-quality, affordable health insurance for all Americans.